Hello, I'm Dr. Jonathan Bertman, Chief Medical Officer at MTBC. Well, today we're at the doorstep of a new technology that's as disruptive to medicine as was the automobile. Because before cars, the home visit really was the bread and butter of medicine. In fact, I bet that patient satisfaction was a lot higher, as was clinician satisfaction. After all, has anybody ever really looked forward to going to the doctor's office? I think the answer to that is no, and so the point is that telehealth is really a disruptive, amazing technology that's just beginning to encompass and change medicine. So this overview will cover some of the basics of that and the current state of reimbursement and other issues that it's reasonable to know as telehealth begins to take a major role in medicine. So what is telehealth? Today already we can connect through patient portals and send a message back and forth in a HIPAA-compliant manner. This is telehealth. We do that now. It's the asynchronous exchange of data with clinician. That's classically telehealth. And it's not far-fetched to imagine popping onto our mobile phones and FaceTiming with a doctor. And in fact, that's happening too through certain companies and including ours shortly. But the point is that that's telemedicine. A face-to-face, a real-time, synchronous encounter between people is telemedicine, and telehealth encompasses that and everything else, like sending messages related to clinical aspects. And really, the primary difference in the words telehealth and telemedicine really depends on who you ask. And so we asked who, as in the World Health Organization, and they describe telehealth as a large category into which telemedicine falls. And in this model, it's generally how it's thought of. That telemedicine is when care is being provided in a real-time, face-to-face or visual and audio live feed using technology to connect these two remote parties. And telehealth, by contrast, would also include all of that, but also everything else clinically and medically related that's being transmitted. And so that's really what telehealth is. And as we've talked about, it really depends. This would be the face-to-face encounter. And again, this is, you could do this with FaceTime, although it's not HIPAA compliant. In fact, I saw recently that the Justice Department had asked Apple not to add encryption to some of its text messaging. But the encryption is required to be HIPAA compliant. So there is a little bit of a battle right now in what allows things to be telehealth, telemedicine, and what is not. And so being aware of what is HIPAA compliant is important. So, of course, telemedicine is great for all aspects of medical care. If we just imagine for a moment that you want to call because you have a cut on your arm and you want somebody to look at it and see, do you need stitches or can you just wash, how should you care for this? So being able to hop on to your portal and connect with your clinician or another clinician and ask those questions is key. And, some areas are much more conducive to telemedicine and telehealth than other areas. For example, if you need a physical exam to understand if something's going on, then telehealth visit is not, or an e-visit is not really that great. And so finding the sweet spot in what can be cared for remotely and what cannot is important. And that's really kind of how telehealth can really apply to your own practice, because it's not too difficult to imagine a scenario where your EHR allows you to schedule telehealth visits for Monday morning. And during those many telehealth visits that you can go through, you can decide, this is something I really need to see the patient for. Let's bring them in. Or this is something the patient really needs to go see another clinician for because I'm not available. Or this is something I can handle now and follow up either through a telehealth visit or seeing them in person later. So telehealth, once the tool is available to build into your practice, can very easily help you triage your week and find really useful means to figure out who has to come in, who doesn't need to come in, open up slots for the patients you really need to see, and not require all of the people to come in and go out and that don't require that, to follow up stuff that's easy to figure out. Like, oh, your allergies are flaring? Okay, well, why don't you try XYZ and we'll go from there. So if we want to implement telemedicine and telehealth into our practice, how best to approach this? First, you need an EHR that supports that, obviously. You could use some third-party technology if it's HIPAA compliant and jump back and forth to try and document your note, but pretty much I think it's pretty clear that the telehealth and telemedicine will be done through our EHRs, where we have access to the patient's information and where we can document the face-to-face real-time encounter. And so because it involves our office technology, it's important to involve the staff and get buy-in to understand, why are we doing this? I mean, I think the Monday morning example will be good enough for most. But certainly recognizing where telehealth can help ease the burdens that are occurring in the practice every day, I think will lead to easy buy-in, especially if the technology is usable and, of course, affordable. I think it's also important, as we begin to incorporate this into our practices, to find a way to ensure our patients are happy. It's interesting to me that so far the slowest adoption to this, other than the fact that it's not being uniformly reimbursed and the laws are confusing, and we'll get to that in a moment, is that patients really aren't yet comfortable to pick up their mobile device and connect face-to-face, and it's just we're not used to it. But I really believe that once people start to recognize how powerful this will be, that essentially, you have someone crying and you're about to go on a trip and you want to connect with your doctor and say, hey, is this okay? If that can be reimbursed, if that can be performed in a manner that doesn't take the clinician away from their other busy schedule and duties of the day, then it's win-win. And I think everyone will really be excited. So understanding what our patients are looking for and educating them to what we can provide is going to be really important as well. So of course it's pretty obvious that once telemedicine is reimbursed, once there's a model that allows us to incorporate it into our daily practice, it's a no-brainer. It makes life easier for everyone. And as a doctor, I certainly am not saying that we should avoid being with patients and connecting in a face-to-face encounter in a real space, in a real place where we can appropriately put our hands on when we do exams and do all of the things that doctor-patient relationship encompasses. But many aspects of the doctor-patient relationship don't require an in-person, face-to-face visit. And this is pretty clear. And I think the reason we've come to require patients to get to the office and come back for follow-ups, and many of the times it's because that's how reimbursement works. So we work around the system to be reimbursed for our time and for our knowledge. And as reimbursement starts to recognize, and studies are beginning to show the benefit of telemedicine in terms of cost reduction, it will very quickly become an aspect where a reimbursement starts to push us and encourage us to use this technology. And, so the question of reimbursement is really important. Well, reimbursement is currently not nearly as extensive as it should be, and it's encumbered by many regulations. For example, Medicare rules on reimbursing telehealth requires a number of conditions be met. Typically, telehealth encounters are reimbursable only if they are provided for beneficiaries who live in certain rural or underserved areas, and usually require the beneficiary receiving the telehealth services to be physically located at certain, quote, originating sites, unquote, such as a practitioner's office or a hospital or a rural health clinic or nursing home, but generally not their own personal home. So that is yet to really occur, but it's coming. Medicare also has additional rules that put limits on this technology and, of course, require it to be HIPAA compliant and add other details on what technology can and cannot be used. And these details have really made for slow adoption of this exciting technology. But as CMS finds ways to focus care on those most lacking, telehealth will and already is becoming rapidly intertwined with daily practice. And in fact, a number of new codes are coming out in the January 2020 rules from CMS, and these include disparate services that will be covered without some of those originating site requirements, including behavioral health, addiction treatment, even home dialysis, areas where the benefit to the patients and the clinicians just can't be overstated, and reimbursement on a equal on-par basis makes sense. And today, 48 states and Washington, D.C. provide reimbursement in some form for synchronous or live video fee for service. And that, I think, will increase in terms of the number of services that will be covered. Interestingly, the two states that did not have any written definitive policies as of now are Massachusetts and Rhode Island. Rhode Island is where I'm licensed to practice. So I think kind of some of the take-home messages here are really that if we want to incorporate telemedicine and telehealth into our practices today, we really need a technology to help us, because reimbursement is confusing, and unless we just want to start doing this the way we once started doing phone calls, and we know where that led us into phone calls that are part of our medical practice and are not reimbursed and take away time from other responsibilities that we have. So if we want to incorporate telehealth into our practices and not just sort of make it a standard thing we do, which I would highly advise against, I think we need to have our technology platform do it for us. We have to be on an EHR that supports the technology, that doesn't require us to go and open some other window in a different program altogether and jump back and forth. And technically, the window is always supposed to be open and sort of on the top of the screen to be having a true synchronous face-to-face visit. And so being part of the EHR is key, and being part of tied in so we know what will be reimbursed, what won't be reimbursed, bringing information to the point of care, such as what information do we need to make sure we have, what we don't. These are all what's coming and what's really exciting about telehealth and telemedicine. So, especially as we think about the next generation of people using our healthcare systems, the elderly, the baby boomers, the Gen X, the Gen Y, the millennials, the Gen Z. My kids, for example, are really interested in connecting remotely. They are not interested in schlepping to the doctors. Now, honestly, neither am I. And as we talked about, neither are many. But I think the bottom line is that, as we move forward, the norm will be connecting remotely. And so ensuring that our technology and our software supports this and makes it easy is the key. So thank you for listening. For more information on TalkMD, you can come to the www.talkmd.com website. There's a form there also where you can sign up for some future upcoming webinars where we'll talk in more detail about other topics such as licensing and proper documentation and other things that are important for the clinician. Thank you for listening. I'm John Bertman. I'll talk to you later. Bye.